Hi, everyone, and welcome to our monthly research briefing. I'm Vanessa Weisbrod from the Celiac Disease Program at Boston Children's Hospital, and this month we're talking about a new paper about gaps and opportunities in celiac disease research and what a potential research roadmap to treatments and a cure for celiac disease could look like. This paper is the result of a meeting held by the Society for the Study of Celiac Disease and the Celiac Disease Foundation. As usual, we have our Director of Research, Dr. Jocelyn Sylvester, here to answer questions about the paper. So, Dr. Sylvester, this paper was the result of a consensus workshop that was held in March of 2020. Can you tell our listeners who attended the meeting and what the goals of the workshop were?
Yes, so this was actually it's often referred to as the last celiac meeting because it was literally in New York City on March the 7th on the eve of the COVID-19 pandemic in 2020. So this was a meeting that included leading celiac researchers as well as representatives from pharma and patient support groups. And the purpose was to really take stock of where we're at, where we need to go, and what we need to get there. And the special guest at the conference was really the National Institutes of Health because they have been tasked by Congress, thanks to the lobbying of some of our celiac disease patient organizations, to spend more money on celiac disease. And so we wanted an opportunity to talk to them about where we are and what we need in celiac disease.
That's great. Can you tell us about some of the gaps and opportunities that the group identified, and what were some of the key takeaways that will help researchers get closer to finding a cure?
Absolutely. So I think at the most basic level, we have a disease that has 2, maybe 3 diagnostic tests and 1 treatment, and everybody gets the same thing, no matter what their symptoms are or how old they are. And so we talk a lot about personalized medicine. And in celiac disease, we almost just need medicine because while food is medicine, a gluten-free diet is not a very reliable medicine. And so how do we get there to having better treatments? Part of that is better understanding. But if we look in the broader field and think about other autoimmune diseases, we're actually kind of far ahead in celiac disease because we know how to turn the disease on and how to turn the disease off in people, which is a huge tool towards studying it and understanding how the immune system is working. And so those are some of our strengths. Some of our weaknesses are that compared to other diseases, celiac disease research is a relatively small community, which is why you could get many celiac researchers in one room. And so that scale is limiting. And one of the things that's always limiting, of course, is funding. But we have the double challenge of both funding and human resources and interest, because since there's no demonstration that there's a need or a market for treatments for celiac disease, it's harder sometimes to sell that it's something worth doing because doesn't everybody do okay on a gluten-free diet? Even though as clinicians, we know that not everybody does okay on a gluten-free diet, and a gluten-free diet is just not okay.
And as many of our patients probably sitting here listening to this probably agree that the gluten-free diet is hard and it's not something that is ideal for any of them. Why is this roadmap important for the future of funding from the NIH for celiac research?
That's a great question. And I mentioned the NIH earlier because the NIH is the largest funder, largest government funder of scientific research in the country. And they've been tasked with funding more research in celiac disease. And so one of the things they do is they put out requests for applications, and it'll be, you have up to this much money to do a clinical trial in digestive disease, which could be celiac disease, could be Crohn's disease. And there's not necessarily one disease favored over the other. It's a competition. And so what they do from time to time is they recognize that there's areas where there's a need for more research or there's important questions. So a very recent concrete example is the COVID-19 virus. So after the pandemic emerged, one of the things the National Institutes of Health did is start announcing and earmarking opportunities for COVID research. And so they've recently announced and are earmarking opportunities for research in celiac disease. And what's exciting is that a lot of the things that we talked about at the conference are reflected in that, and they've really expressed an interest in understanding everything from how does celiac disease develop? How do you prevent it? What's the mechanism? How is it that people can be okay with gluten and then develop celiac disease and suddenly not be okay? And how do we monitor how people are doing? And what about treatments and what are the long-term consequences? And so I'm hopeful that we will see more celiac research coming. And it's really exciting to see the NIH taking an interest in celiac disease.
Absolutely. So does publishing of this roadmap paper guarantee NIH funding for celiac researchers?
No, so NIH funding is awarded in competitions. So in order to get funding from the NIH, researchers write grants, and there's a lot of rules about the grants, the margins, how long they are, how much money you're allowed to spend, where you're allowed to spend it, what you're allowed to spend it on. And so within those restrictions, pitching an idea and pitching a scientific plan to test that idea becomes a research grant. And then there's committees who look at, for instance, research grants in digestive disease. And then they may be seeing grants from different diseases, but they try and apply the same criteria and score them. And then the grants with the best scores are typically the ones that get funded.
So what happens next? You've written this amazing roadmap. You've identified the areas to work on. How do you make all of these things become a reality?
So I think one of the most important things in life is if you don't run, you can't win. If you don't write the grant and you don't submit it to the NIH, then they definitely will not fund it. And so one of the things we need is, as a community, to come together and make sure that we are giving the NIH opportunities to fund celiac disease. And so I think this is really the next phase. We've identified where we want to go. And now there's lots of work happening on the ground to try and plan that out and see how we can get there and how we can ask the NIH for help.
So we've seen lots of news pieces and blog posts and lobby days where patients have been asked to write to their members of Congress and to, encourage more funding for NIH. Is that something that patient families should continue to do?
Absolutely. I think that this is a limited time period. It's not that the NIH is saying we're forever interested in celiac disease. Somewhat like there previously was a lot of interest in HIV, and now there's less interest in HIV, but that doesn't mean that there's not still HIV and it's not still a problem. And so I think much more powerful than me is constituents. And so any opportunity you have to communicate with your representatives and elect representatives, it's important to think about the issues that are important to you, and hopefully those include celiac disease.
Great. Well, thank you so much, Dr. Sylvester, for taking the time, as always, to explain this paper to our patient families. We really hope that everyone enjoyed this brief, and we will talk to all of you again next month.